Question number 1.
Sarah, with chronic renal failure, was scheduled for hemodialysis. He has a maintenance dose of enalapril, Vasotec, for her hypertension. The nurse should instruct the client to take the enalapril, Vasotec on A. Just before dialysis. B. During dialysis. C. On return from dialysis. D. The day after dialysis. Let's apply the process of elimination. Just before the dialysis may cause hypotension of the patient, as there are electrolyte disturbances that happens during the procedure, making option A incorrect. If taken during the dialysis, will just remove the medication from the bloodstream, making it useless to take. This makes option B incorrect. On return from dialysis, when the patient is hemodynamically stable and the procedure is done, is the most appropriate time to give the patient his antihypertensive medications. This makes option C a correct statement. The day after the dialysis is already considered as too late. Complications related to hypertension might already happen, which makes option D incorrect. Therefore, the correct answer is letter C.
Question number 2.
Nurse Mimi is taking care for a patient with chronic renal failure who will undergo peritoneal dialysis. She should take note that the appropriate time of infusion of dialysate should be A. 15 minutes, B. 30 minutes, C. 1 hour, D. 2 hours. The correct answer is letter A, 15 minutes. Peritoneal dialysis is a treatment for kidney failure that uses the lining of your abdomen or belly to filter your blood inside your body. A cleansing fluid called dialysate passes through a catheter tube into part of the abdomen known as the peritoneal cavity. This process is called infusion, which only takes 15 minutes. Next, the fluid is left inside the abdomen, and the client can proceed to normal activities, which is called the dwell time that usually takes 4 to 6 hours. Lastly, while the dialysis solution is inside your belly, it absorbs wastes and extra fluid from your body. The solution and the wastes are drained out of your belly into the empty bag, which takes around 10 minutes.
Question number 3.
Nurse Mimi explained to Brian that one of the components of dialysate is glucose. As part of client teaching, the purpose of glucose is A. Prevents excess glucose from being removed from the client. B. Decreases risk of peritonitis. C. Prevents disequilibrium syndrome. D. Increased osmotic pressure to produce ultrafiltration. The correct answer is letter D, increases osmotic pressure to produce ultrafiltration. Increasing the glucose concentration makes the solution more hypertonic. A hypertonic solution is any external solution that has a high solute concentration and low water concentration compared to body fluids. This makes excess fluid and wastes in the peritoneal cavity goes with the solution and then drained out of the body.
Question number 4.
Nurse Mimi is providing nurse-client education to Sarah with diabetes mellitus about peritoneal dialysis. The nurse tells her that it is important to maintain the dwell time for the dialysis at the prescribed time because of the risk of A. Disequilibrium syndrome, B. Hyperglycemia, C. Fluid overload, D. Infection. The correct answer is letter B, hyperglycemia. An extended dwell time increases the risk of hyperglycemia in the client with diabetes mellitus as a result of absorption of glucose from the dialysate and electrolyte changes. Diabetic clients may require extra insulin when receiving peritoneal dialysis.
Question number 5.
During the process of dialysate infusion, Brian asked Nurse Mimi, why is it warm? Nurse Mimi doesn't require further teaching if she says A. So that the body would not react during the infusion. B. To force potassium back into the cells. C. To encourage the removal of serum urea. D. To promote abdominal muscle relaxation. The correct answer is letter C, to encourage the removal of serum urea. The main reason for warming the peritoneal dialysis solution is that the warm solution helps dilate peritoneal vessels, which increases urea clearance. Here is the comparison in infusing cold versus warm dialysate. Cold causes vasoconstriction, thus less urea is filtered out from the blood vessels, while warm causes vasodilation, increasing blood vessel permeability and urea removal.
Question number 6.
Brian, who has permanent peritoneal catheter in place, undergone a dialysis procedure. During Brian's dialysis, Nurse Mimi observed that the solution draining from the abdomen is consistently blood-tinged. Which interpretation of this observation would be correct? A. It is normal to have bleeding with a permanent peritoneal catheter during the procedure. B. Bleeding can indicate kidney damage. C. Bleeding indicates abdominal blood vessel damage. D. Bleeding is caused by too rapid infusion of the dialysate. The correct answer is letter C. Bleeding indicates abdominal blood vessel damage. Because the client has a permanent catheter in place, blood-tinged drainage should not occur. Persistent blood-tinged drainage could indicate damage to the abdominal vessels, and the physician should be notified.
Question number 7.
Brian, who was diagnosed with renal failure, asked Nurse Mimi what type of dialysis would best suits for him, hemodialysis or peritoneal dialysis. Nurse Mimi is correct if she says that peritoneal dialysis is indicated if A. The patient must be hemodynamically stable. B. The vascular access must have healed. C. The patient must be in a home setting. D. Hemodialysis must have failed. The correct answer is letter A. The patient must be hemodynamically stable. Hemodynamic stability must be established before continuous peritoneal dialysis can be started. Starting dialysis with a peritoneal dialysis is preferable compared to hemodialysis in terms of patient morbidity, mortality, and cost. Here are the following strong indications for peritoneal dialysis. Vascular access failure. Vascular access is where the dialysis machine will connect to your bloodstream. During dialysis treatments, the dialysis machine cleans your blood, then moves it back into your body. If this method is not possible due to certain conditions, then that's the time doctors opt to peritoneal dialysis. Needle phobia, also known as fear of needles. Vascular access involves 15 to 14 gauge needles to support the higher blood flow rates. This aids in flow rates of is greater than or equal to 350 milliliters per minute, needed for high-efficiency dialysis. If the patient has this characteristics, then medical practitioners opt for peritoneal dialysis. Congestive heart failure. It is a long-term condition in which your heart can't pump blood well enough to meet your body's needs. Hemodialysis can further cause complications, thus this would indicate an alternative way, which is through peritoneal. Children aged 0 to 5 years. This age bucket doesn't have enough vascular access yet to support the hemodialysis, therefore they are opt to peritoneal dialysis. Coagulopathy. It is defined as any derangement of hemostasis resulting in either excessive bleeding or clotting, although most typically it is defined as impaired clot formation. Therefore, hemodialysis is not an option for them.
How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.